How do neurologists diagnose migraine, tension, and cluster headaches? Imagine feeling a pounding, squeezing, or sharp pain in your head and wondering what's causing it. That's where neurologists step in to help figure out what's behind your headaches. They use a careful process to make an accurate diagnosis. First, they start with a detailed chat about your headache history. They ask how often your headaches happen, how long they last, where the pain is, and how severe it feels. They also want to know if certain things trigger your headaches, like foods, stress, or sleep issues. They'll ask about other symptoms like nausea, sensitivity to light or sound, or visual disturbances called aura. For migraines, they look for specific features like pulsating pain that lasts from 4 to 72 hours and affects one side of the head. Cluster headaches usually cause intense pain around one, often with tearing or nasal congestion. Tension headaches tend to be dull, tight feelings on both sides of the head, with less severity. Next, the neurologist performs a physical and neurological exam. They check your vital signs and examine your head, neck, and scalp for tenderness or abnormalities. They test your eye movements, pupil responses, and visual fields to see if there are signs of pressure or nerve issues. They also evaluate your cranial nerves, muscle strength, sensation, reflexes, coordination, and gait. This helps rule out other problems like infections, tumors, or blood vessel issues that could cause headaches. Diagnosis is based on established clinical criteria. For example, migraines are identified by their pattern of symptoms, like throbbing pain, nausea, and aura. Tension headaches are diagnosed when the pain is bilateral and feels like a tight band around the head. Cluster headaches are recognized by their episodic nature and associated eye symptoms. Imaging tests like magnetic resonance imaging or computed tomography scans are not routine but are used if your doctor notices red flags. These red flags include sudden severe pain, neurological deficits, or headaches in people over 50. Imaging helps rule out tumors, bleeding, or infections. Sometimes, a magnetic resonance angiography is done to check blood vessels, especially if vascular causes are suspected. A lumbar puncture might be performed if infection or increased pressure inside the skull is suspected. All this information helps neurologists distinguish primary headaches from secondary causes that need urgent treatment. They also educate patients about headache triggers and management options. This careful process ensures the right diagnosis and helps develop a tailored treatment plan. In the end, neurologists relying on your history, physical exam, and selective tests to identify whether you have a migraine, tension headache, or cluster headache, and to rule out other serious conditions.